David Dyke is Chief Product Officer with Relatient. They're an organization making healthcare simpler by optimizing each step of the patient journey. Welcome back to the show, David.
Thank you, George. Thanks for having me. It's great to be back.
Yeah, excited to have you back on. Tell us a little about your personal lives, more about your work, and why you do what you do.
Yeah, personal life. Since we talked last, my wife and I have celebrated our 25th wedding anniversary
Nice.
um, in a row, which I always like to add as a caveat. And I our daughter continues to thrive up in Chicago in professional sales, and our son is now off the payroll as well. It's been a couple years since we talked, and he was finishing up his undergrad. He's since gotten his MBA, and he's consulting, and he's engaged. So, I'll tell you, life continues to move here in the frozen tundra of Oklahoma. And we just couldn't be happier, couldn't be more fortunate. So,
Nice. That is
yeah,
a that is a lot of action right there. When
it
you tell
is. We put up some
people,
good numbers in the last couple years. Yeah,
yeah,
yeah.
25 years in a row, does your wife roll her eyes or does she like elbow you
She
or
she does she is we like to say she's actually the funny one in our
Hmm.
household. She reminds me that I'm her best husband yet, and I'm her first husband, but she likes to keep me on my toes. So it's important to stay grounded.
Yeah, totally
Yeah,
get that.
yeah, yeah.
So give us an update
Uh,
on what you've been working on professionally. I know that
yeah, it's been an exciting couple of years since we've talked. We really focus. Our mission continues to be driven by our belief that people deserve a simpler experience with healthcare, and we've spent a lot of time in the last year and a half really trying to understand those points of friction, those points of complexity, and I'd like to think that simplicity has. There's a lot of ways to define it, but the three that work best for me, at least, are recognizing that as a consumer of a thing, right, whether it's a news story or anything, right, it needs to be clear, and I have to understand the context and to have it be concise and friendly and consumable. Um, Simplicity is also accessible, that it meets me where I am, and it doesn't create a lot of barriers to access, and that it's fundamentally, distills something down to being efficient and has the fewest steps. And if those need to be guided, they're guided. If they can be self-directed, they're self-directed. And those sort of principles for us, this last couple of years has really helped us focus on modernizing, improving our patient self-service scheduling experiences. We were very fortunate to be awarded by class research as best in class for patient self-service scheduling. It was a new category they created, and we were very fortunate to be selected as their best in class product. I'd like to say our response to that was to tear down our product completely and rebuild it, because there were so many opportunities to bring more simplicity to that experience for patients, to make it easier, to have it be fewer steps, to be more concise. And we're rolling that out now, and a lot of enthusiasm and a lot of excitement within our customers who have been very patient with us because, tearing things down and rebuilding them is hard. Yeah, things have momentum, right? Things have change is a hard thing for folks and organizations and ourselves to wrestle with. So, bringing a new patient self-service experience to market is one of our big goals this year. And we've really tried to focus on the patient experience. How do we make it simple? How do we make it easy? How do I think about, as a healthcare veteran, I know a lot of the words in healthcare, and George, you may not, right? And how do I make it easy for you as my target audience and not design a product that makes sense to me as a product nerd? Yeah. Um, and that's exciting. It's going to be a lot of fun to roll that out and to see it take shape.
appreciate all that. So from a self-service perspective, self-scheduling, I I have to imagine that there's a benefit on both sides of that equation, self-scheduling from a patient
Yeah.
perspective, but what is the benefit or the value to the providers?
Yeah, it's a great question. I think, that accessibility leg of that simplicity stool brings a lot to both parties, right? How do I make it 24/7 for me as a consumer? And how do, as a staff, as an organization, how do I help ensure my people are practicing in our industry. We like to say at the top of their license, how do I make sure that people are doing the highest and best job that they can perform? And so if a creation of an appointment is one big step, but the management of that appointment is another one. I have a doctor's appointment tomorrow afternoon, in fact, and there's a reasonable chance I'm going to have to reschedule it because of a customer call. And that's just the nature of me prioritizing, right? That this is a routine care. It's not a big deal. I've already got my lab tests. I know kind of what the answer is going to be. I could move that to virtual. I could move that to another day of the week. So that ability to be accessible and meet me where I am, which is to say, how do I most effectively change that appointment, right, is a big part of that process. And take the friction out of it, right? Avoid a phone call so I can do a digital experience, which is highly convenient to me, reliable for the provider, easy for me, the patient, accurate, from the provider's perspective, and doesn't create new work downstream. So that's a big part of what we think about on in terms of the trade-off and the benefits for both parties.
And I mean, technology is wonderful when it works, and obviously you're really good at making the technology work. How has the experience been giving older people, here's tech, do
Yeah,
this? How is that
yeah.
learning curve, the uptake gone?
Yeah, it's going well. In fact, our data shows us that um, a plurality, I'll say, not a majority, a plurality of the users of self-scheduling skew older. We think of apps and mobility as a younger person's game. I think they've a TikTok universe that we're moving into, but the data shows that most healthcare is consumed by people who are older, and they are rabid fans, right, of self-service. I tend to think of my dad, who's in his early 80s now, and how do I think about him as one of my main customers in this experience, and make an experience that works for him on his phone and is clear and easy to use. And I think that kind of flows into the efficiency leg of our stool, which is when necessary, that experience can be guided. Right? How do I prompt and nudge and inform in the moment, asking questions that are relevant rather than questions that are prescribed? Right? If you're coming to us for a question about your arm, let's ask you arm relevant questions, not a list of questions that we want to ask because we ask everybody, but let's make the questions about George and what George is here for and how George's current state and things we know about George influence that next visit of care that he's about to have. So it's really that doing things that are simple is really, really hard in a lot of ways, especially in healthcare. And so I'm having a good understanding of the goals of an organization, as well as the goals of that consumer, balancing those out is what we're striving to do.
Yeah, I totally get that. Doing things simply is really hard. Oh, doing simple things is hard. Is that are both of those
Yeah,
things true?
I think, a simple thing, doing a hard thing simply maybe is the right way to think about that.
Yeah.
A simple thing, um, it, it- what you touched on with your question, right, with whether it's a folks that are have the disability, right, have any kind of technical limitation, have any of those kinds of factors, having that experience be easy for them is just as important as having that experience be for someone who's been to that provider 100 times and knows the routines and is familiar. So we think a lot about new patient experience, someone who's new to the organization versus a veteran, right? Someone who's been there before, and how do we simplify that for them? How do we bring that context of who they are into the workflow, and make it easy for you as a returning patient. And then new patients maybe often, they tend to be the ones who use the tools. Actually, it's kind of an inverse. The data also skews to new patient acquisition for these tools that are digital first. Um, and when we think also about accessibility, it's also about moving it from just, say, an app or a website to having that experience be contextual. How do I meet people, as I said earlier, meet them where they are? If I've picked up the phone and I've made a call, working with other technology vendors and opening up APIs that allow the intelligence that we manage for these organizations to be expressed through a phone system, right? Press one to reschedule your appointment. Hi, George, welcome back. Automated attendance and systems that are using AI to guide that experience for you. And again, avoid reaching a person as the only path, right? If you say representative, great, come on in, let's get you talking to a person. So I tend to think about that experiential continuum going from sort of digital call deflection right on one end to concierge at the other end. And those
Hmm.
are both reasonable outcomes depending on George and how what you want to do when you call in. So when we think about that goal of simplicity, it's not uniformity, it's not consistency, it's not, these are the only three steps you can take. It's about having that contextual understanding of how you want to be engaged with, and whether that's a chat modality or a phone call or an outbound text or a web service that you visit on your own time, making sure that those are all accurate and quality experiences for you and for your family and for people that you take care of.
Yeah, I can definitely see where that would be hard to do, David.
Yeah, well, like I said last time, I think there's plenty to do, so we'll keep coming back until it's done. You know, um, we talked last time about fax machines in healthcare, and I think I was kind of reflecting on that this morning. The fax machine's killer app in healthcare is that it's simple. It's fire and forget. If you have a piece of paper, which healthcare is rich with, right? Put it in the machine, type in a phone number, hit go, right? And it's that simplicity that is also really difficult to dislodge. And that's why I think it continues to be such a pervasive form of communications of things. You had Bo Holland on recently and the All Clear team, and that exchange of clinical information via fax is still such a pervasive method of moving gobs and gobs and gobs of information about you, about me, between two parties across that chasm, and those firewalls between two organizations. And we see that in our world. We see it with appointment scheduling and referrals, and we're really trying to open up those pathways, as I mentioned, with APIs and digital pathways, so that those can be done in the context of both parties. If you're sending me a patient, how do I make sure it's easy and can be built into your team's workflow so they don't have to change where they're doing things and how they're doing things in order to get that information over to me? And then I can send information back and close that loop so that we can take care of the patient as a coordinated team. So I think that's where we see the evolution of simplicity for us, moving from just patient facing experiences to provider experiences, as well as kind of that closing the loop between providers back to patients as things move down the care path. So,
Yeah, well, that certainly makes sense, and it's a really nice thing to be able to meet people where they are. Sometimes maybe my mom wants to have a phone call, and sometimes she probably doesn't. So to be able
exactly, yeah.
to give her those
And
options.
if you want to have a phone call, I used to joke my primary care provider was also in his late 70s at the time, and as his schedule got shorter and shorter during the day, my joke was that if I didn't get sick on his schedule, I had to see somebody else.
Hmm.
And there was a lot of truth to that, right? Which is, if you're working Monday, Wednesday, Friday, or Monday, Wednesday, or mornings, there's an element of availability and accessibility, and that constrains capacity and makes it challenging for folks to continue to receive care from whoever they're used to seeing. So, but we recognize that those are the realities, and that I might want to see my primary care provider isn't the only provider I can see. And so how do we make that experience easy for me to recognize that I searched for George, but Trent is right here and he can take good care of me? And how do we use that technology to steer me and inform me in the moment as to alternatives that are appropriate, part of the same team, all in the same system, and make that a cohesive experience and improve my the time that it takes for me to receive care. Yeah.
Yeah, which I really see as a big benefit to everybody. It's not necessarily rocket science that if I am a physician and I work 5 days a week, I have the ability to see, just in round numbers, 50 people during those
Yep.
5 days. And therefore, if somebody has to cancel or doesn't show up, is there a way to quickly bring somebody else because I'm sure that there's
That's
other
right.
patients who are sort of orbiting who would like to see me sooner? And or is there a different provider within the practice or the same expertise
Yeah.
who could take the call virtually instead of going into the office? So all that kind of stuff.
That's right. You've touched on it's several of the 1.6 million moving parts, I think, in healthcare scheduling that we think about, right? Alternative places of care, alternative providers, wait listing, um, notifications and confirmations. And we talked last time about the communication work that we do to help ensure that after the appointment's created, that you're ready for it. That if you haven't been there in a while, you've completed your paperwork and they've signed the authorizations and you've answered the questions that'll make that experience more efficient. But just like you said, if when things change, if I cancel my appointment today or reschedule it today, I'm within that 24-hour window. That's a hard slot to refill, right? So I think about myself and going, I, I don't want to move that appointment because it's almost too late for them to refill it. But we do try to bring that kind of capability to our customers so that they can take advantage of, just like you said, that wait list, right? That standby list, like you're on an airplane. And if you're this person on standby, you hope I don't show up so that you
Yeah.
can get on that flight and get home. And the same thing applies in healthcare. How do we make sure that that capacity doesn't go to waste?
You have a sense of how many appointments actually get seen or how many blank spaces show up in a physician's calendar on a daily basis?
Yeah, we do. We have it varies widely. We've done a lot of analysis on this. I think the my general rule of thumb is that people don't miss appointments for scary things. And so when we look at things like visit reason, right, or the severity of a condition, um, those tend to be the appointments that have fractions of a percent, right,
Pretty sticky.
of a yeah, pretty sticky. Follow-up care though might have a 15 or 20%, right, especially your second or third follow-up. Routine care, like I talked about for myself, has a pretty high cancellation rate or no-show rate. And there's a lot of variables that flow into that. It and I'll just use myself again as that experience. It's not a time sensitive, clinically sensitive appointment for me tomorrow. It's routine. So the chance of me moving it's easier for me to move because there's no risk fundamentally, right? Um, I need it to happen, but it doesn't have to happen on Wednesday. And so those kinds of appointments do vary. I think that there's variations across clinical specialties. Some see, no-show rates in the low single digits, and others might have routine, primary care, urgent care appointments that have a no-show rate or a late cancellation rate in the 15 to 20% range, depending on the type of specialty. The one thing that is, I think, most promising is our data shows that patients are much less likely across all those categories to miss appointments that they create themselves. So when I have
Hmm.
ownership of that and when I'm using a self-service tool, it effectively reduces that no-show rate by a third, sometimes a half, depending on the clinical specialty and the level of care. So that often skews to because it skews to new patients, right? New patients are less likely to miss appointments. So some of that is a byproduct of the who, right? And what patients are using, what people are using those tools. But patients that are empowered follow through. I think is a really clear takeaway in the data. Yeah,
Yeah, well, that certainly makes sense. All right, so it's been a couple years since you've been on, which sounds pretty wild.
it really
But
does.
in
Yeah.
that 2 years, AI has been on the tip of everybody's tongue. How is that? Is that a new thing for your world? Is it more of the same?
Yeah, it is a new thing in a lot of areas. I think we're using it operationally, we're using it internally to help our business be smarter, to move faster, to make more effective use of data to do that kind of quick evaluations, whether it's um, understanding the variability in the regulatory framework that is healthcare, right? Or creating new conversational experiences for patients in a chat kind of model. How do we bring AI into those steps to again be accurate and be efficient and to help an organization maximize the human capacity that they have by letting the technology do some of the work around the edges. I think that's where most of our customers are. Like, how do we use whether it's AI or something equivalent to that, in a way that's around the edges. We have others that are we're experimenting in areas around clinical, triage and determination of the right level of care for folks based on questions that you can ask in a non-invasive way. Um, there's still a lot to come. I think it's AI. We were talking to some groups recently, and one of the things they said of their own technology is we don't know why it did this, but it did the right thing. And I said, that's really cool and super scary in healthcare, right? Because you can't tell me that that wasn't an accurate, it was an accident. And is that repeatable? Is it going to get it right every time? And the threshold for quality in healthcare, rightfully so, is effectively zero defects, right? That's kind of what we shoot for. It's going to continue to make big strides. It's definitely impressed us all in terms of what LLMs can do. Um, but we also are cautious that we have to bring the right tool to the job. I have sort of an analogy I've used in healthcare that if I'm putting in a garden, I could use a backhoe or a spade. And in my flower bed, a spade is almost always the right tool, right? They're both dirt movers. They're both designed for moving material from one place to another. But the right tool is the important, deployment there. And a backhoe is not always the right answer. So kind of using that same methodology an AI that can do things right consistently, and is predictable and is understood might be exactly right what you need in the middle. And then a lot of our customers are using third-party phone systems that are built on AI, and they're connecting those to our API so that they can manage scheduling experiences. And I think that's a great first use case because there's always an exit path, right? There's an exit ramp if you to a person, and it's a low risk, high volume, good return use case for us to build on.
Never a dull moment, David.
No, never a dull moment.
Well, thank you so much for coming back on. Where can people learn more? How can they get involved?
Yeah, we are at Relatient.com. You can follow us on LinkedIn as well. We have a really active set of content that we're putting out on LinkedIn as well. We spend a lot of time out there and have really been excited over the last couple of years to grow our presence on that platform as well as others. So, and we'll be at healthcare shows near you in 2025 as well.
Excellent. Well, if you enjoyed this as much as I did, show David your appreciation. Share today's show with a friend who also appreciates good ideas. Go to Relatient.com. Check out all the resources and what David's been working on. Find him on LinkedIn as well. Put all of those in the notes of the show and look for them and him at the next conference that you are at. Thanks again, David.
Thanks again, George. Have a great
Until
day.
next time, remember, do your part by doing your best.